I am now going to provide mouth care. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. I'm going to help you brush your teeth this morning. Give me just a minute, and I'm going to wash my hands. Can I wash my hands? Great. Let me just check your ID band. You are Mrs. Jones. And now I'm going to pull the curtain to give you some privacy. Now I'm going to gather all my supplies. A towel, some gloves, a glass of water, a kidney basin with a toothbrush, toothpaste, and also a barrier on my side table here. All right. Mrs. Jones, I'm going to raise the head of your bed
75 to 90 degrees.
Okay? All right. I'm going to place this towel across your chest just to cover your clothing. So we got a little clothing protector there. All right. I'm going to wet the toothbrush a little bit. Place a small amount of toothpaste. All right, Mrs. Jones, you open up for me. Okay, I'm going to start at the bottom. Going up. Okay, can you close your teeth together? There we go. Good. Now I'm going to close your teeth together again. There we go. Good. Open up again and stick your tongue out for me. I think we got everything. Maybe let me try the top one more time, make sure I get all of that out there. Good. And spit out. Here's some water for you. Okay. All right, make sure that your mouth is all clean there. Great. All right. Now I'm going to clean my basin. And to rinse her toothbrush. Place the basin in the designated dirty area. I remove my gloves. I wash my hands. Mrs. Jones, here's your call light. I'm going to put the head of the bed down a little bit. Is that comfortable there? Okay, great. Now I'm finished.
Unconscious client. Raise the level of the bed to help you maintain good posture and use proper mechanics. Lower the bed rail on your side of the bed and move the overbed table to the side.
Dane, we're going to roll you on your side now.
Remind staff of the importance of explaining actions as care is given, because the patient's hearing may remain intact when other senses are not. Your supplies include gloves, a towel, sponge swabs, padded tongue blade, cleaning agent, a kidney basin, water glass with fresh water, and lubricant for the lips. Reposition your patient to a side-lying position facing you. Put on gloves. It is important to position the patient's head well to the side to reduce the risk of aspiration. Place the towel under his face and the kidney basin under his chin. Position the overbed table within easy reach and adjust the height as needed. Use the padded tongue blade to gently separate the upper and lower teeth. Never force the jaws open. Use caution so that you are not accidentally bitten should the client bite down. You may keep the tongue blade in place if needed to avoid using your fingers to keep the mouth open. The bacteria in a person's mouth make bites especially hazardous, and gloves do not provide sufficient protection. Moisten the sponge swabs in the cleaning agent and begin cleaning the outer surfaces of the teeth first. Use gentle strokes as you clean the teeth and gums, the roof of the mouth, the inside of the cheeks, the tongue, and the lips. Observe the appearance of the mouth, gums, and teeth, and note any changes. Be sure that any liquid is draining out of the patient's mouth. When you are finished, moisten a clean sponge swab with water and rinse the surfaces you have just cleaned. Place all used swabs and the tongue blade in the kidney basin and apply lubricant to the patient's lips. Remove the towel, discard your gloves, and tell your patient that you are going to reposition him again.
Jane, we're done. We're going to roll you back over on your back.
Place the call light within his reach. Then, raise the bed rail and return the bed to its lowest position.